Good morning and happy day to you. I'm Lindsay Anderson, and I'll be discussing some change topics that we are having within the community that all are welcome to. It's a multi-denominational effort, and if you've heard of this before, feel free to ignore me. This is just the intro video to catch anybody up that has never heard of this before. But we are doing coffee chats every Sunday and discussing the building of a united ecumenical health ministry. So this is an immersion video to get you up to speed. Important things to note are that these are 30-minute chats that will be ending around 11:45. You can come in late or leave whenever you wish, and they're involuntary and informal. Also, there's going to be an online audience, possibly, if anyone chooses to join through Facebook Live and Microsoft Teams. The information is with the arrow pointed down, which will be on the next slide as well. Locations also will change every 4 months, fall, winter, and summer. So ultimately, feel free to express yourself anytime and be respectful of others. Also, it's in the Bible. We shouldn't grumble or dispute. Top right corner, you'll hit the search. You can also do in the top right corner of the main page. You're going to type in United Ecumenical Health Ministry. I've already done so, so I'm going to click on that. You can scroll down below the About section with all the information there. You see the Featured section, and it has items that you can scroll through that are important that I've pinned for you to be able to easily find. The very last one posted on August 26th, you'll click that. Scroll down. If you see a pop-up thing that says no thanks, hit that as well. Then you'll hit the virtual link for the Microsoft Teams. You get the redirect notice, hit the Teams again. You already need the Microsoft Teams downloaded ahead of time. Make sure your video is on if you want to be seen by others in the chat. And also know that this will be recorded on Facebook Live. I will be recording the presenter, just myself and the screen, but since you will be on the screen, please be aware if you do or do not want your picture shown. And make sure your mic is off when you are not being able to discuss anything, as this could have echoes and background noises. So please mute yourself when you're not speaking. And then your speaker, you can also adjust that up and down. Lastly, I'm not going to click into that, but you would click Join Now. And please note that if you have any issues, you can always call me. We can trial this to let you, if you've never used Microsoft Teams, I can work through it with you anytime, as long as it's not during the meeting. You can also get the Facebook like button on the left. There is the Facebook page, and that way if you do that, you will be notified when we are going live for events. Otherwise, I think you can access it possibly through, once it's done, unless if you're on there specifically at 11:15, and remember, you can access it, just the videos that are posted as they will be live, and so you can catch up that way after the live. But if you want to actually participate and you don't know how to do it through the Facebook Live, you're always welcome to also access the Google Doc link on the page, and that's open to people who have Facebook and don't, as this is a website that is offered offline as well if you don't have Facebook. So I also have a tutorial there on the left. Trying to figure out the best way to encapsulate all that we're doing here is to do as Jesus did, and he used parables to teach. So I'm going to be showing you, this is a planting a mustard seed to heal many in rural Illinois. So below you have the soil, it looks like a tree, but I also made it into a cross. And we have united, which means we're all consolidated, and ecumenical of different churches, and a health ministry. So providing healing, health, a space that is safe for mind, body, soul, whole person care. So we are needing very important things to grow and thrive, and that is water, sunlight, and soil. So we need to first build a good foundation, and that's what these meetings are for, to be able to start and grow. And we are also, our foundation is built on the cornerstone of Christ. So he is going to support us. We are going to be praying for guidance and extending our organization that we hope to be in a safe way and he is going to be driving the plan. So also, we also want to also need peace and love and encouragement and wisdom, so we can get that through each other and through sharing our spiritual gifts. Also, you need sunlight. He is the light and the path. So also all of that will mean a bright future. So whatever happens, if we're in doubt, if there's, troubles and barriers, also know that there's always a light guiding. So lastly, the water. We need water to sustain this new movement. So we are not growing alone. You need much water. So we, all of us doing this fellowship as together, we are the rain, like we are the water, the body of this. And so it is critical that we all work together to voice ourselves and build whatever design that we want to implement. Lastly, I wanted to show that at the center is the word shalom, and around that are the 4 townships within our town, the Suez, North Henderson, and Spring Grove, and Kelly. So really bringing the crossroads of all of these townships together in the shalom, which is at the heart of faith community nursing, as it means in the scripture wholeness and health, and it describes a harmony in all the relationships with God and with others, with yourself, and with the environment. And it is a holistic view that it reflects God's desire that we live in peace with everything around us, including the pursuit of health within ourselves and helping others. So this came from a 20-page, wonderful, amazing paper by Deborah Zebarth. She is a leading doctoral prepared faith community nurse, and she wrote Evolutionary Conceptualized Analysis of Faith Community Nursing, and that was done in 2014. And it basically gives a constructive model that is going to be the basis for building what we are going to do and being able to visualize it also. So there's, it's at the core of it, you can see on the left, I blew up the bottom picture towards the right because really that's at the center, just so that you could see it more. But really at the center, it's the relationship between the faith community nurse and the client, which the client could be the person, a family, a group, or a community. And it's an interactive motion over time when that specific client seeks or is targeted for holistic healthcare with the goal of optimizing the holistic health functioning of that whole system, the system of either that client being a person, family, group, or the community. So right now we're focusing largely on the community, just because those are like the easier programs that we could implement, the primary care, preventative primary strategies. Eventually, when we have more assistants and more volunteers, we can do way more. But this is just the first step. It's the first mustard seed. Many disciplines are collaborating within a health ministry, and so it's the clergy, staff, faith community leaders, faith community nurses, members of that faith community, like the elders, or anybody who's actually just interested in health and wellness can come. And so you also have community partners, other health professionals, so the registered dietitians, exercise physiologists, physical therapists, institutions, agencies, hospice, OSF, Unity Point, any of those, because they both also have faith community nursing programs in Peoria and Moline. And they're distinct roles for many people. So if you're a caregiver, if you love babysitting and it integrates all these different disciplines who are interested in health and wellness. So how does this ministry actually help the community? There are all of these things listed here. So basically, we're going to be building relationships within the congregation and within the outreach programs to the community. So we promote health, not only in the absence of disease, but as the whole healing process of spiritual, physical, social, psychological well-being. So that's through providing education, by spreading information that would support the community to achieve optimal health and well-being and to reduce their health risks. Knowledge is key, and providing the teaching and the caring environment with the support really builds people up and is able to promote that health and accountability and fellowship so that they come back. And we can treat individuals, families, congregation, the whole community really at large. If we embrace all these different roles of being advocates and coordinators, training volunteers, being volunteers, or promoting health in different settings. So we can do, coming out of the hospital, transitional care, going, if you are in the hospital and you want someone to come and visit you, just call and request and let us help you with whatever each person individually wants. And that's the best thing. It's patient-centered care to the fullest. So all the activities here, you can pick, they will be able to pick, and we could do these throughout the years. I want to build a sustainable program that we are able to provide blood pressure screenings and actually explain why the blood pressure is and why we're worried about it, or create a bulletin boards or a newsletter that shows whole person health, mind, body, and spirit, being able to connect both faith and health together, and healing health fairs, bereavement, grief support groups, substance abuse support groups. Really, it's endless. So it's whatever we can actually want to do per that semester. So if we want to do, not semester, but every 4 months, we could put on a little community class. And then in the meantime, if there's congregations that need physical needs, we can also do that as well, being able to educate the congregation members of basic first aid, first and foremost, safety first. So all of these are to come, hopefully, in the future. Have you been feeling a calling to help, but you just don't know how? Well, this is a model that visualizes all the needs that we potentially could fill if we have a great body. So the board of directors currently has 7 people on there. We have not met yet, but there are always room for more. If you have expertise in leadership and especially have created nonprofits before and you want to be involved, you are most welcome. Also, the research team, I'm doing a doctoral project right now, and if you have any interest in research, let me know. The next one is the advising. So you're consulting or you're an expert in a field of law, of health, of education, of theology. Everything this is a beautiful thing that combines all the disciplines, and when we work as a team, we're going to be very successful. So the community outreach programs would be for churches. Specifically, the 3 that have signed up so far are the Village Baptist, the Lutheran, Zion Lutheran, and the United Presbyterian. So training right now is safety first always, and then we can move on from there. But the adult health programs that we possibly would do would be like a walking program or a mind, body, soul support group. The family health could be also including kids with that for the parental consent would be the first and foremost, just for red tape there. But we can do programs also with kids. Eventually, once we figure out the red tape, because we would just want to do school age and we would have to have parental consent as always. And most likely lots of elementary teachers would really be very key in those programs. The promotional teams would be making sure the sustainable program is there with the building blocks. So we got to make sure we have budgeting and funding and fundraising and advertising And then lastly, the faith community nursing. I want to specifically say that volunteers don't always have to be nurses, but the foundation of the health ministry is also we need the actual nurses. And so there is a faith community nursing curriculum that is online at Westberg Institute. You can go on there, see the events. There's multiple programs. I went to one, it was about $450. There's ones that are cheaper, about $200, and sometimes they have scholarships if you go in state. So there are multiple opportunities to gather information on faith community nursing, and you don't have to be a nurse to even go to that. Eventually, we could provide scholarships, if we get enough fundraising so that we could build more faith community nurses in this area. You may be asking, when is this and where is this taking place? So here we have the different phases. And what I am thinking of originally is, because I'm in a doctoral program right now, I'm thinking in semesters. So every 4 months, plus that would help with quarterly, because you would know if you're on the board, we're most likely, from what I've been reading, is having quarterly board meetings that you could either attend in person or virtually, but more information to the board members at a later date. But for the community, you're welcome always to attend these coffee chats, and we'll be having them in the fall, winter, summer, and then in the fall phase again. So in each of those phases, those are the focuses that we will be aiming for. And in the winter, we're of the new year is when we're going to start, because we just want a fresh start, fresh off, fresh in the new year. So 2024 is the year we go live. So you're asking yourself, why are we talking about change? Why do we need to change? There is a huge evidence, and I will show you this on the next slides. And you can also view the Alexis Health Needs surveys that many of you answered over the summer, just in 2023 right now. And so, but first and foremost, your stories matter. And rural health testimonies that I've gotten from multiple, I've heard that no one is ready for any kind of emergency preparedness at churches, all the way to they're calling for emergency purpose, like they're calling 911 while they're at church, and the dispatchers can't. It's retrieving your calls because we're in Alexis and going to Warren County when you need help from Mercer County, and they can't call and transfer your call. So you're having to waste precious time calling the sheriff's office in Mercer County. Instead, all of these things, you can have a person designated for calling while another person is doing the actual act of possible CPR should they need it. And so that things run smoothly, and that way the good care is being given in this rural environment, because there's a huge divide of what is known to be good care in the area and what are people actually getting. And so we do not have access, and we will discuss this further, but there's a huge buy-in in this community that they want this and they need it. So we are going to give them what they want. And so also many people are wanting to donate already, and I cannot accept any funds. We cannot accept any funds until we complete a corporation, because we do not want to do any kind of red tape. It's just easier if we just make a corporation and then accept. It's just red tape otherwise. And so that's the main reason why we're having to do a nonprofit, is because all of our churches, we don't have the resources. Most health ministries are created in line item budgets within the church, and they're able to easily go about their business. They don't have to go through all of this extra nonprofit applications, because they're already within the church. So because we're so rural, we have less faith communities. Our congregations are anywhere from 12 to 40 I've seen on the ones that I've been at around the area. But the congregations are dwindling, and so to be able to have the resources and the people that know we need to combine. And so because it's a combined effort, we have to create our own nonprofit. And so there is a huge calling of being able to serve. Also, as my way of doing this, I feel like I'm tithing, giving back to God and doing what my God-given gift was. You know, it's not about the money. It's about helping and serving and advocating. So also the faith community nursing. There is so many people that I've talked to who never heard about this. They don't know what a health ministry is. And we're talking, these are nurses, these are graduate nurses that I'm polling and asking, that I'm going to the classes with. And even, you know, other health fields. They've never heard. It's a specialty that has been here since the 80s, and it's internationally. And it's just interesting that it all started here in Chicago, of all places, with a Lutheran minister. And that's also Westberg, why we have Westberg Institute. And so this was all started in Chicago, and it's not known. And so the lack of awareness of this amazing specialty is what is also driving the research for my doctoral program. So I will very much appreciate if you continue in helping me improve our community. So our little town of Alexis, we are, very proud of being the home of the Clydesdales and of the fire equipment. We build ambulances and fire trucks, but yet we have severe lack of access to care, even though we're creating those emergency, transportation, which is a little ironic if you think about it, because, we have no access to primary care physicians here or mental health care providers or nurse practitioners. And NPs are nurse practitioners, PAs are physical assistants, and certified nurse specialists. So those are the diabetic care educators. And also you can think of this also as registered dietitians. There are none. You have to travel at least 36 miles to the Quad Cities or 66 miles to the Peoria to be able to access actual healthcare providers and a higher level of care, and also your other health experts. So really we need access to care, and also our quality of life here. There is so much physical and mental distress. Those are technically having more than 14 days of distress over a month. So we have high rates here. And this was from the Alexis data, is from the faith community needs assessment that I did over the summer. But you can see the health rankings data. You can see you just type in 2023 health rankings, county health rankings, and you will see here like 70, our Mercer County, there's 15,000 people to just one provider. Continuing on, there are the health behaviors that are also very concerning in our area. So the Alexis data is still from the Community Health Needs Assessment, but of those that completed it, 46% were obese, which is a BMI greater than 30. So we have also a huge active group that are not, 50% of the people here are physically inactive. So that was on the 2023 county health rankings. It's when you're not working outside, when you're not exercising outside of work. So access to exercise opportunities also, we don't have any open gyms here in Alexis. And also if you look in the state, 90% of people typically are able to have access to exercise opportunities, but in just Mercer County there's 27%, and that is just shows that we need walking programs here, especially and that was also on the health needs assessment. It was like 75% of you wanted the exercise programs, strength training programs. It was a phenomenal call for help with exercise. So that's first and foremost, most likely going to be our first project that we go out to the community with. Also, excessive drinking. And I didn't test them. I didn't, quiz on not quiz, but survey this. So the data, the ones that say data needed, we can eventually do another health assessment. I didn't want to inundate people with surveys. So, but it still shows that 20% of our population just in Mercer County are smoking. And this is true and tried and know like how bad it is. So we really can have help programs to really support people to quitting should they wish to, and then also drinking. Many people don't understand that, what's the typical recommendation for an alcoholic beverage per day, and if you're having more than that, it's health education is a major need in this area, and limited access to foods. Literally, it's if you're just having access to a grocery store. So the only thing that we have here is Dollar General, and just that little aisle of they sell bananas, and it's just we could have a community garden and have free produce, and people could have fresh produce. It would take lots of work, but all of this, if there's a will, there is a way. And right now, there is a need. So we need to make a way. Thank you for listening. And if you have any questions, you're welcome to come and chat with us any Sunday or call me personally on my cell 309-337-9288. The board members here are also available should you know them. I didn't want to give their contact information quite yet. And also, I want to give a huge thank you to everyone that has been contributing to this in the Sunday coffee chats, to the people who did the surveys, to any experts or consultants that I've discussed any of the subjects with, as well as my doctoral team that has 3 members. So my doctoral Northern Illinois University chair, Dr. Marcia Cook, my doctoral expert is Dr. Sharon T. Hinton, and she's from Faith Community Nurse from Westberg Institute. Very good mentor. And then also the preceptor here in our local area is Jennifer Hammerlink, and she has wonderful depth of knowledge and experience as a retired Mercer County Public Health Department director and supervisor of multiple programs that are just awe-inspiring, and she's helping with grants as well. So she is also a wonderful person to be working with, and I look forward to working with everybody in the years to come and creating something wonderful for our community that sustains and lasts and continues to give